So I am showing that we are live on Facebook. If you're here on the Institute for Creative Mindfulness page for our 5 o'clock live stream, you're in the right place. I am just going to give folks about a minute or two to find us, so you can go ahead and make yourselves comfortable, sit back, and I'm going to bounce this over to my personal page while I do that, because some people find us easier there. So Debbie, I know you told me before we went on air, how is the weather in the Boston area today?
It is gray and rainy and sticky.
Oh, it's been very sticky in Ohio as well of late. We've
Yeah.
definitely been feeling summer, although I am actually joining y'all from Chicago today. I'm here visiting a friend, and uh, but that's the nice thing with this virtual world, right? You can do almost everything from anywhere. So
Absolutely.
yes. So welcome. I'm just doing a check here to make sure that everything's working technologically for us. If you're here for the 5 p.m. Eastern livecast with Dr. Debbie Korn, you are in the right place. And if you're able to join us for only part of the interview, please know that you will have indefinite access right here on the Facebook page. You can go back and watch the rest of the interview later, because we know some people pop in and out for this. And because we're looking forward here to having just a really, really amazing conversation about Debbie's new project together with Michael Baldwin, and just so many things about EMDR in general. So, again, formally welcome those of you who are joining us live. And it is my great pleasure to introduce someone who, to me, is an EMDR legend, certainly one of my EMDR role models, Dr. Debbie Korn. I know she gets embarrassed when I say that, yet if anybody has ever done any research or academic study in EMDR, you've probably cited Korn and Leeds 2002. This is Debbie Korn of that paper's fame. And Debbie also wrote another amazing paper about using EMDR to treat complex PTSD, which we may be talking about at some point here during the interview. But today, the focus of our conversation is going to be on Debbie's new release, Debbie's first book. Congratulations.
Thank you.
Every Memory Deserves Respect, which is co-authored with Michael Baldwin. So Debbie, tell us a little bit about when you first got trained in EMDR. How did that come about? How did EMDR come into your life?
Well, I first heard about EMDR from my graduate school mentor, Andy Sweet, on a trip back to Denver. I went to University of Denver, School of Professional Psychology, and I was back in Denver visiting with Andy, and he said, "Deb, you have got to go get trained in this new method. It's going to revolutionize how we treat trauma survivors, and you need to run. You need to not walk, but you need to run and go get trained." And I got trained the very next year. I got trained in 1991 and 1992 with Francine Shapiro. And at the time that I got trained, I was the clinical director of the Women's Trauma and Dissociation Unit at Brookside Hospital, Charter Brookside Hospital in Nashua, New Hampshire. And I started using EMDR the day after I finished my weekend one training with inpatient complex trauma and dissociation folks.
That's amazing. So I know we are going to get to talking about the book. Yet that disclosure amazes me, because even today as a trainer, knowing so much more about EMDR than we did in 1991, 92, there can be this hesitancy. Like, I don't want to touch complex trauma. I don't want to touch dissociation. Yeah. The clients are too complex. Do you think it was just your sense of adventure, your knowledge of your clinical base, or were you just so excited about what EMDR was able to do?
I think it was all of that plus naivete and youth. I was quite young. It was early in my career, so I wasn't afraid of much. I was passionate about helping people. I had a great inpatient team. We had a great unit. So, the foundation was there to get to work quickly with people. And I think I trusted my clinical capacity to adapt and innovate as needed. And, out of that experience, I, very quickly learned that folks with extensive trauma needed more than just safe place to start the work. And so out of that came, the start of resourcing with clients, the start of RDI, resource development and installation, started experimenting and innovating a lot to help people maintain their dual attention, to feel braver, more courageous in doing the work. And also out of that early work came a very rapid recognition that this idea of staying out of the way wasn't always what was needed. With more complex trauma, more dissociative clients, I learned that there really was a place for more active use of interweaves in helping to keep them in their window of tolerance, in helping them stay connected to the present, helping them stay connected to me, bringing in information into the processing that would help them turn the corners that they needed to turn. So, you think on your feet when you have to. And, that was what the early days were about. I knew there was something really phenomenal in my hands, but it really needed adaptations and tweaking to be able to use it with a more severely traumatized population.
Right. And we will certainly be circling back to talking about some more of the early days and the evolution. Thanks to those of you who are joining us live right now. If you do want to put in the comments where you're joining us from, I always like to see that. And if you have a question of Debbie at any point, if you're here with us live, I'm monitoring the chat to see if there's any questions that come through. So tell us about how Every Memory Deserves Respect came to be as an idea.
Absolutely. So first, I just want to mention that Every Memory Deserves Respect stands for EMDR. Not everybody gets that at the first glance, so I just want to make sure. Right. I got really tired over the years of people coming and asking for treatment and not being able to remember the name of the therapy or getting the letters all jumbled. So we thought we'd come up with a very easy to remember title that captured
I dig it. Yeah.
the initials. So basically, about 2.5 years ago, maybe a little longer than that, Michael Baldwin sent me an email, and I did not know Michael. I did not know his name. He got my name from his EMDR therapist, Jeffrey Magnavita, Dr. Jeffrey Magnavita in Connecticut. Michael was wrapping up 2 years of treatment, 2 years of intensive treatment with Jeffrey Magnavita. And he had this idea for a book. His career has been in the field of marketing and communications, and he's a very visual guy, very creative. And he had this idea of creating a book about trauma, about recovery, about psychotherapy that was written in 2 voices, the voice of a client, the voice of a survivor, and the voice of a trauma expert. He also had this idea of combining imagery, photographs, and text. And the book is filled with what we call billboards. Right, the book is filled with what we call billboards, where on one side you've got a full page visual image, and on the other page you've got a little bit of text like what you'd see on a billboard. And basically the book is, in a sense, it's almost 2 books in one. It's the text. That's one of my absolute favorites in the book. Clients are passengers on a train watching the scenery go by. The therapist is the conductor. So the book is, there's the narrative, the written narrative, and then there are the images. And for someone who has a hard time picking up a book and reading it from start to finish, it gives you lots of respite in the midst of text, or you can just, it tells the story literally in pictures as well. So it's kind of 2 books in one in that sense. And interestingly, Michael was unable to read in the early years of his life. He had reading tutors. He went to school after school for many years. He had all kinds of learning challenges when he was younger. He probably could have been diagnosed with ADHD when he was younger. But it was, it's pretty clear now, in like listening to his whole history and knowing where he is today, that really his brain had been traumatized and his brain was not working as it needed to work. And the difficulties with reading and remembering song lyrics and tuning into the world around him. And he had also a significant history of having falls and getting concussions. So he was not in his body. He was not able to concentrate. And so this idea of creating a book for trauma survivors that will be accessible, that will be user-friendly, that can be read over the course of an evening or a weekend or a week or whatever, was something that was very, very important to us.
Yes, that's one of the reasons I'm so excited about this, is I do believe it is probably the most client-friendly book that's out there. I mean, the only we have, Dr. Shapiro's Getting Past Your Past and her original EMDR, the Breakthrough Eye Movement, which I do think are good books for the general public, but the visual appeal of this is what, as an expressive artist, really, really impressed me, Debbie, when you first sent me the review copy. And as you said, how a lot of people get overwhelmed by just this sea of text.
Yeah.
And they're beautiful visuals that really put into view a lot of what we're talking about here with trauma concepts. And I think the other element here that is super friendly to the general public is that you do have that client voice together with not just an expert voice, but an expert such as yourself, who is so human and writes with a lot of warmth.
Thank you.
That just really, really comes through. So what did it feel like being that you weren't his actual therapist? Do you think that helped your collaboration, or what was your collaborative relationship like with him? Maybe that's a better way to ask the question.
Yeah, we loved working together on this book. We had a lot of fun. We had deep conversations. Even though Michael has finished the bulk of his recovery work, he still goes back to see his therapist from time to time when there's pieces of work he wants to do. And so, he was continuing on his journey as we wrote this book together. And so he would have revelations. We'd have a conversation or we'd talk about a piece from the book, and he would get clearer about something. And as he got clearer, I would get clearer. So it was a very synergistic process. And I had primarily written only for academic journals and textbooks. And so writing for the lay public was relatively new for me. I was excited about it, but it was new. And so having Michael at my side to kind of say, Debbie, you're being too clinical, or what does that word dysregulation mean? Or, can you explain these attachment styles one more time to me? And I was like, okay, I have to be even clearer here.
Right.
So it was like a wonderful process in that sense. And we engaged, and you'll like this, Jamie, in terms of your interests, we began the whole process with interviews. I had someone interview me about, we had an outline, and then I was interviewed, and then I interviewed Michael, and I interviewed Michael's therapist. And from those transcripts, we started to pull together the basis for the book. And I think because we started that way, the book does have an easier, more accessible feel because we're in conversation.
That really comes through.
Yeah.
That truly comes through. And to EMDR therapists who are just tuning in or who are watching this now or later, this is the book we've needed. When clients have said, well, do you something like I can read about it? Yes, this is that book, because of the voice, because of the way that a lot of the concepts we do want to impart to clients. Like Debbie has this beautiful chapter. They both have this beautiful chapter, How Does Trauma Affect Your Brain? And it goes into a lot of the triune brain understanding, yet there's a beautiful graphic and beautiful explanations that I don't feel pander or talk down to people, but at the same time doesn't overwhelm. So this is a wonderful book that I think will supplement a lot of EMDR clients' journeys. It's rather affordable, and I'm just very impressed with what you've done. So how did it feel writing your first book? This is mostly just kind of me as your friend chatting with you about this,
Yeah,
especially as somebody who's written a lot of like
yeah,
clinical
I know.
textbooks and clinical
I
articles.
know.
How
I
did it feel
know.
to write your first book of this nature?
Well, as I was saying, it was wonderful to be writing it with Michael. He
Mm-hmm.
kept me honest. He kept me clear. He helped me to write in an accessible language. It was pretty incredible writing a book about trauma and about trauma recovery during the pandemic and
Mm-hmm.
in the midst of the racial strife and the political
Mm-hmm.
strife of the past year.
Mm-hmm.
So it was very challenging because I was having to work on regulating myself on a daily basis. But it was interesting because I was observing in myself and observing in my clients the
Mm-hmm.
phenomena that we were writing about
Mm-hmm.
live. Like as I was
Right.
writing, we were all experiencing trauma. We were
Mm-hmm.
all having to get ourselves regulated in the face of overwhelm on a regular basis. So that was fascinating. And also, I had to really struggle with having so much to say. There was so much I wanted to write about that reflected my own learning and my own growth and my own integration of other models and neuroscience and all of that. And I really had to struggle with keeping the book simple enough, accessible enough and informative enough, but not too much. And so I had to make some
Mm-hmm.
hard decisions about leaving, like, what's an example? I so much wanted to include information about polyvagal theory and
Mm-hmm.
polyvagal informed therapy in with the book. And that's an example of something that I just decided to leave out because there's a whole nother concept. It's complicated. It's not, it can be made simple, but I had to opt to keep it to
Right.
the
Oh
side.
yeah. Mm-hmm.
So there was just so much that I would have loved to write about, but we really opted to keep it EMDR focused and really user friendly.
Well, when that happens, that means you'll end up writing more books probably with your other ideas percolating over. So, what do you hope the contribution will be of this book to the EMDR community? What would you like to see happen with it?
Yeah, well, we wrote this book with a lot of different populations in mind, a lot of different people in mind.
Mm-hmm.
So this book is written for the EMDR client, somebody just coming into therapy or contemplating therapy, or even an EMDR client who's well into therapy, or even at the tail end of their therapy. So
Mm-hmm.
that's, one person we wrote the book for. We also wrote the book for someone who's struggling in their life. They don't know why they're struggling. They have no idea that anything that they're experiencing is related to what we'd call trauma. Somebody browsing the shelves at Barnes and Noble that would be drawn to this and be curious and start to think about the fact that some of their struggles are related to experiences in their lives, and who would be encouraged to pursue a psychotherapy that could really end their suffering. And then we also, wanted to write a book that could be used by people outside of our field. So lawyers and doctors and
Mm-hmm.
teachers and probation officers, as we work to establish more of a trauma-informed society,
Mm-hmm.
the more we can educate people who are interfacing with human beings who are struggling with trauma in its various forms, whether it's substance abuse or domestic violence, or all the ways that people who've been affected by trauma wind up manifesting their pain or defending against their pain, brings them into contact with all these other professionals. So, the hope is that this book could reach those hands as well, and that
Mm-hmm.
it also could be a book for family and friends of those suffering.
Mm-hmm.
And so really our hope is that EMDR can make it to a place out there in the world that you could be at any kind of gathering and people would know what you're talking about.
Yes.
I'm so used to being places and people that I would expect would have heard about EMDR or would know about EMDR don't even know
Hmm.
that it exists. And that's after 30 years and lots
Right.
of research.
Yet I will say in the last year or two,
Yes,
especially, I
yes,
have been noticing more recognition of
yes,
people I interact with. It's interesting you mentioned lawyers because my whole team of lawyers that I work with and some lawyer friends I have, like, oh yeah, you do that EMDR thing. I've been hearing about that.
yeah,
And so that's exciting to me
yes,
that even when was doing some business here with one of them, I'm like, oh, how do I explain EMDR to a lawyer? And he had already heard about it,
right,
which I
right,
think is good. And I think with
yes,
Prince Harry's recent
yes,
press, that's
absolutely,
given a needed boost, and Russell Brand before him. And so, I mean, we're going to talk a little bit here in a minute about just the evolution you've seen in 30 years. But I know since I got trained in 05, 06, I've just noticed so much more recognition even
yes,
since then. And I think this will be a big propeller to that process.
yes,
And like you said, a book we can give or recommend to people who might be overwhelmed by the clinical literature on
right.
it. So Debbie, now as you look back on 30 years of being involved with this, uh, how do you? Because I remember I heard that Francine was asked this question once at an EMDRIA conference, like, how do you feel after 25 years? And I remember her honest response was, actually, I thought we'd be further by now. And
Uh,
everybody kind of laughed uh, by that. So how do you feel, Debbie Korn, being one of the early people trained? What has it been like for you these last 30 years to watch this evolution?
yeah. Well, the evolution has really been from a technique to a
Hmm.
comprehensive psychotherapy. And I think we're
Right.
still growing and expanding and figuring out who we are as a comprehensive psychotherapy. Um, I think when Francine published in 1989, she immediately came under incredible attacks. Folks that are, more newly trained in EMDR know nothing of that early history, perhaps. In 1989, when she published, her study was one of 4 studies published on the treatment of PTSD that year. They were the first randomized controlled studies to ever be published on the treatment of PTSD. And the other, I think 2 of the studies were on flooding, and one
Hmm.
was on desensitization, and the 4th was
Hmm.
Francine's on
Hmm.
EMD at the time,
MD,
right? It
yeah.
wasn't even EMDR. It was a desensitization technique. And but I think because she came under attack by people like, I don't know if these names ring a bell for anyone, McNally and Lohr and Lilienfeld and Herbert, just to name a handful that were
Right.
very actively critical, calling EMDR pseudoscience and calling EMDR, calling the eye movements bogus, and it's nothing more than exposure therapy. And it's just a marketing the
Yeah.
claims of effectiveness were just about marketing tactics. Because there was such adversity, I think the community became very close very quickly and really mobilized to try to bring credibility. And Francine leaned very heavily in the early days because of this controversy and criticism. She started leaning very heavily toward research, and she really emphasized fidelity to the protocol.
Hmm.
Both of those things are very important and important to
Hmm.
me. That said, I think it also may have excluded people. It may have excluded some early innovation or
Hmm.
creativity. And I think, now years later, where we're reaping the benefits of years of research, Francine's battle cry paid off because
Sure.
the research, was mobilized, and now we sit on a very solid empirical foundation, I think we're circling around again to innovation and integration with other models. And we're struggling to define what is the core, what is the heart of EMDR therapy, what are the critical components, and where is there room for integration and originality and all of that. And we also have years of attachment studies and interpersonal neurobiology and neuroscience, bearing down on what we're doing and influencing the way we think about transformation and change and what's needed for true healing. So it's exciting to me in terms of where we are now. And I've always considered myself a assimilative integrationist, a term I learned a couple of years back, where my home base, my primary orientation, my first language and first love has always been EMDR for 30 years. But into that framework, I draw and I pull all that I've learned over these 30 years from other models and other conceptual frameworks. And I think it's an exciting time because we're getting clearer about what are those core components of effective psychotherapies. What are the core components of experientially, somatically focused psychotherapies? And we're working from that basis and expanding out from there to develop ways of working with not only PTSD and complex PTSD, but many, many other mental health issues, many other disorders.
I resonate so strongly and relate to what you shared about EMDR being your core and your first love, because at the end of the day, that is how I primarily identify clinically. Yet something we say in our program is EMDR can play very well with other therapies and other approaches, especially in phase 2, which is something I know that you're very well known for. And what you said at the beginning of this interview, that one safe place is not going to do it. And we needed to really build on that. So what was that like for you when you started kind of emphasizing the need for some of that? Was that met well, or did you have to fight to really get that more recognized?
When we started to talk about and write about doing resourcing in the preparation phase, I would say that the reception was very, very warm. Because everyone out there doing EMDR was seeing the same things that I was seeing on my inpatient unit and in my outpatient work as well, that that despite the best intentions of therapist and client, there needed to be some foundational work to help clients get more safely embodied, to get grounded in the present moment, to get regulated enough to begin the work. And so I think we were welcomed. We were, applauded and welcomed because we were speaking to a need that was there. Everyone was so excited about EMDR and really expanding the way that they were applying EMDR, but therapists were hitting bumps. And of course, no one wants to do harm. Everyone wants therapy to be helpful and safe. And so the reception was quite good. And I think that there's been a lot of expansion since the early days of resource development and installation. There's been a lot of innovations in terms of how to help people get resourced, integrating more somatically focused work, integrating expressive arts. So there's really a lot that we can do to get folks to that start line for the deeper processing.
So with your clients, and I also know you still offer quite a bit of consultation, what do you think are the essential skills EMDR therapists have to have in phase 2, aside from the standards, the calm, safe place, container, light stream? What do you like to teach your consultees, and what do you like to use with your clients?
Well, again, I want to be sure to make the point that not every client is going to need resource work in phase 2 or phase 2.
Yeah. Mm-hmm.
In addition to safe place, container, those basics, many
Mm-hmm.
clients are able to go pretty smoothly into the
Yep.
processing work. So I just want to be
Mm-hmm.
really clear, because one of the things that came out of the introduction of RDI was I would start hearing these stories of therapists that were spending weeks and months doing resourcing work when there was no indication that the client needed that.
Yeah.
So it's really important to have the
Mm-hmm.
capacity to do ego strengthening and resourcing
Right.
work with clients, but really important still that we are always trying to get to the trauma focused work, to the processing
Mm-hmm.
work as efficiently and as effectively as we
Yeah.
can. So
Yeah.
I want to say that just as a little caveat right up front.
Cool.
And so your question was, what kind of work is important for therapists to
Mm-hmm.
bring to their work, especially with more complex clients?
Yeah, and the reason I'm asking is a question that I will still hear on the message boards, a question that I hear from a lot of consultees I've worked with over the years is, my client can't do a safe place.
Right.
And even though I think safe place can be modified even in what you call it, I also
Mhm.
strongly believe not everybody's optimally visual. For some clients
Right.
who are severely dissociative, it's not the
Right.
best exercise to do. So yeah, what do you, knowing your point and it being very well taken, and I will
Yeah.
have one follow up on it. But what are the skills that you think are pretty essential?
Um, First of all, you need to have a safe and secure enough therapeutic relationship.
Yes.
So conversations about, a lot of meta processing around the therapeutic
Mm-hmm.
relationship. What was it like to share that with me? What was it like to hear this from me? Really, really making sure you're checking out how things are landing with the client in those early stages.
Mm-hmm.
So you really know that they feel held and supported and seen and heard, number one. Number two, I think therapists need to be educated about defenses or protective parts. I think if you try to move too quickly into trauma focused work without recognition of those defenses and the
Mm-hmm.
utility and the importance, the life-saving importance of those defenses, you're going to stall out pretty quickly, or things are going to get worse.
Mm-hmm.
So I think really knowing how to recognize when a client is connected to their body, connected to their emotion, connected to memory, versus somehow at a distance or guarding against that or distracting from that, really being able to see the subtleties of defenses and helping the client to recognize those patterns in themselves, and then
Mm-hmm.
together working to help the client be able to stay grounded in experience.
Mm-hmm.
Really important. I think therapists need to be able to recognize when their client is within the window of tolerance, to use
Mm-hmm.
Siegel's term, um,
Mm-hmm.
and when they're outside, they're either in hypo or hyper arousal.
Mm-hmm.
Um, Lots of clinicians think that the second they start seeing strong emotion, negative emotion, that the client is out of their window of tolerance, and that's
Right.
just not correct, right? The client's having big feelings, but if they're able to stay connected to the therapist, if they're able to stay oriented and maintain that dual attention, if they're able to
Mm-hmm.
observe and go into the processing and then come out and reflect, then they're tolerating it and they're within their window of tolerance. So really learning how to discern where the
Mm-hmm.
client is moment to moment, and not interrupting the client's processing, and not being afraid to go there with clients thinking that they're somehow not tolerating it or they're somehow out of their window of tolerance. Um,
So
and
unpack. Go ahead. I'm sorry, I
yeah,
didn't
I
mean to cut
could
you
keep
off.
going, but go ahead.
Yeah.
I'll,
Well, if you will unpack that with me, because yes, I mean, I agree so much with what you just said, and I get concerned about this affect phobia on the part of therapists,
yes.
just in general, and therapists who get trained in EMDR. And do you think learning to work with that is something training can teach you, or is that something you really need to get your own EMDR and your own personal work to be able to dance with?
Both. Absolutely both. I think,
Yeah.
I have spent a number of years training in a model called AEDP, Accelerated
Oh yeah.
Experiential
Mm-hmm.
Dynamic Psychotherapy. It's Diana Fosha's model.
Fosha's work.
And
Mm-hmm.
it's a model that primarily focuses on affect and attachment. I mean, that's kind of the
Mm-hmm.
core of that model. And I learned a lot. I learned a lot about working with the full range of emotion, intense anger, intense shame. So my
Mm-hmm.
emotional muscles increased through didactic learning and
Mm-hmm.
experiential learning in that model. And that has made my EMDR therapy
Mm-hmm.
better. I also think that uh, watching your own tapes, videotaping your own work, watching your own tapes,
Mm-hmm.
seeing where you back up, where you actually need to go forward, seeing where you take a side route to go back to doing resourcing work when in fact you need to keep your foot on the gas. Really being able to reflect on your work in that experiential kind of way is really important. And then, as you
Mm-hmm.
said, I think looking more carefully at your own issues and your own fears or phobias related to your own upbringing, your own history is really, really important.
Yeah. One more question on this, because I think a struggle I have in training people in knowing the larger EMDR community is there tends to be this extreme we can see people rushing in too quickly with complex trauma and
Yes,
dissociation and go, oh, let me just pull out this protocol and go
right,
back to the touchstone and
right,
don't really have a sense. So I see either like not enough caution or there's an abundance of caution
right.
to the point where I think we're actually withholding good care from people. So,
Absolutely.
a question I like to ask anybody who's an expert in this realm is and I don't think we come across with a hard and fast line because it
Mm,
differs for different folks,
mm,
right? And
right.
therapeutic
It depends.
relationship and clinical judgment. It's very much a case of it depends. But I guess since I have you here to pick your brain, and maybe it'd be interesting to think what Michael would say too,
Mm,
your co-author, what when when's that point where a client seems sufficiently prepared to go there?
mm. I think it's about dual attention and
Mm,
it's about permission. Those are the two things that come to me. Dual attention, meaning you in your moment to moment with the client as you're talking about difficult things, what they're coming in with, week to week, they're able to talk about what's going on with them from a feelingful place
mm,
while staying connected to you, the therapist. And they're able to maintain that sense of observing, right? They're talking about, they're able to observe, and they're not sounding like a 5-year-old child who's been
mhm,
triggered and is terrified of the world. They're sounding like an adult who is noticing a range of feelings, a range of parts that are activated.
mhm,
So number one, being able to stay grounded and present and in that observing, witnessing stance
mhm.
um, prior to going into activating specific memories, number one. And what was the other thing I said? I just lost my thought.
Grounding, we were talking about just dual aware,
The
just
dual
dual
attention and the
attention
other,
imperative.
permission.
Ah, mm,
That was the other thing I said. That I think you don't you want to make sure that you've sufficiently addressed the fears and the anxieties that the client has. You have been curious and you've listened to the protective parts of self that are
mhm,
worried that you're gonna start crying and never stop, you're gonna dissociate and never come back, you're going
mhm,
to be humiliated, you're going to get it wrong and be punished, that talking about your perpetrator is going to bring your perpetrator back into the present moment. So there needs to be some period of exploring what those fears are, what those beliefs are, and they need to be addressed.
yeah,
And once they're addressed, then you're looking for a green light from the client. Like as you check inside, as we talk about beginning to talk about beginning to bring up the memories of traumatic experiences in your life. How does it feel inside? What are you hearing inside? Do we have a green light? And clients can answer that question. They're like, no, there's all kinds of noise in my head, or my muscles get really tense the second you start talking about that. Well, that's maybe a red light, maybe a yellow light, but it's not a green light. So I think, we're working collaboratively and we're working experientially in the preparation phase. It's not simply a matter of teaching skills or doing psychoeducation. We're in an experience with our clients, and we're able to observe how they're tolerating that experience, which is a relational experience. It's an affective experience. It's a somatic experience. And we're getting feedback on that. And we don't want to go forward if we're getting red lights rather than green lights.
I love how you worded that, working collaboratively. So well put. So I'm getting a thank you for you in our comments on putting a good, simple explanation on the window of tolerance.
Okay.
And so somebody's asking, this is a good question. What is your general approach to the container exercise? What do you build containers with people in phase 2? Do you use the container exercise throughout treatment? And if so, how do you approach it?
Yeah, I do create containers with every single client. That, I do safe place. If safe place doesn't work for someone, we do some kind of resource, image, memory that is soothing, that is calming, that is, something that has never been associated with anything other than peace and soothing. So I do that with everyone. I create a container with everyone, and I teach everyone basic grounding and orienting strategies. And I invite clients to come up with absolutely anything that works for them in terms of container imagery. So it might be a file cabinet. It might be a book that they put something in. It might be a jar, a Tupperware container. It might be, sending something to the moon and having it encased in something on the moon or under the ocean. We build as much boundary around we build as much boundary into the container as we need to. It might have to have 50 locks on it. Everyone's going to have a different thought about that. And some folks can come up with a container very easily. And for others, it's a whole session or two.
And you may have to get very creative to the person who asked the question. In expressive arts world, we'll often have people make containers or pantomime opening their container, putting things in, because the key to a container is it's not an avoidant thing where you're locking it away and giving those keys to the 50 locks to a shark. That the intention is, even if you have 50 locks on it, you are empowered to open them. To be able to open the container and work with it. So it is, to me, and the more and more I've developed as an EMDR trainer, I've come to love container even more than I did when I was just an EMDR therapist, because when we train and we do practicum sessions, we're often starting and stopping. A lot of trainees have material that they can't get to in the whole training, but the training's open something up. And of course we refer. I mean, we're very big about do your work. Yet a container is essential for safekeeping until that can be done.
Yeah, and I have, actual containers in my office. I think actually here, I have, my little memory jar that, if somebody wants to leave something in my office, I invite them to leave it with me. There's a relational aspect to containment. We'll hold this together. I might ask clients, what label do you want to put on the container? I think that comes from John Omaha years ago. What should it say on the outside of the container? And once I've been working with someone for a while, I ask them at the end of the session, do you want to put this away? Do we need to put this away in a container, or do you want to just hang out with it? Because as folks develop emotional muscles, as they become more resilient in their work, there's not the need to put things away in the way we do at the very beginning of treatment. So often clients will say, no, I want to reflect on this. I want to visit it during the week.
Wonderful. Thank you. And thank you to our listener for asking the question. It's a very good question. So, and again, those of you joining us just at the tail end, this is Debbie Korn, who's the co-author of the new book, Every Memory Deserves Respect, which is a real, for clients, for the general public, insight into EMDR, plenty of beautiful visual imagery, in addition to just a real human description of EMDR. And once again, highlighting the use of the billboards throughout as a very nice element. And so Debbie, please send my congratulations to Michael, your co-author,
I
and
will.
just on a job well done. Final question for you, because even some of our folks who I know are joining us live are EMDR therapists that have trained in the last 5 years, so newer EMDR therapists. What is your message for us going forward in sharing EMDR with the world?
Well, I think we need to translate what we're doing with people. We need to translate what we understand about trauma into a language that is more accessible. I mean, that's what this book is about, is really helping people to understand that trauma is a part of life. It is not something to be ashamed about. It is universal. There, wealth or status does not protect you from trauma. There are some things that might protect you. I think the color of your skin and the privilege that many of us white people experience in the world protects us from certain kinds of trauma. But I think we want to be inclusive. We want to be reaching out. We want to be, talking with other professions. We want to be talking with therapists who are engaged with other models. I would like to see a lot more cross dialogue across models. We are all aiming for the same thing. We're trying to help people heal and come back to lives worth living. And I would say you want to commit yourself to learning this well. When people come to me and they say, I don't think this works with this kind of client, or it doesn't work with this issue. It's not that EMDR doesn't work with that kind of client or that kind of issue. It's that there's lots of fancy footwork, and there's, people are complex. Problems are complex. Moment to moment psychotherapy is complex, and there's many decision points. And go and get consultation, commit to consultation. And if there's barriers to that, find a peer group, find a group online, learn from one another. But it really takes commitment to learn any psychotherapy well. I am still growing and learning. I can still videotape my work and look at it and cringe and point out a dozen different places where I missed something or I overstepped something. So it really requires that we hold ourselves to the same standard we hold new learners to as we carry on with this work. It's very challenging, rewarding work.
Thank you for that inspiration, that answer. As you're talking, I was getting chills about so much of it, especially even somebody like you who's been doing this for so long is still able to stay in beginner's mind and realize I'm always learning new elements of this. And I'm also very delighted to hear you talk about the collaboration with other models, perhaps other approaches. And I thank you for in the interview sharing how your work with Diana Fosha's model helped helped you with your EMDR. I feel expressive arts and yoga training helped me become a better EMDR therapist, and it was never felt like I was cheating on EMDR. It's that we are all, it's all paths up the same mountain, right?
And Francine was an integrationist from the very
Yes.
beginning. She's got a textbook out that is all
Mm-hmm.
about, right, the interface between different psychotherapy models. And she
Mm-hmm.
always said from the very beginning that, as we learn what works and what doesn't work, as we put things to the test, as other models expand and grow, we want to be bringing that into our AIP model. We want to be bringing it into our methodology.
Right. And I remember an early interview I heard with her. She said something to the effect of, your approach is honored in EMDR.
Mm-hmm.
If you're body centered, if you're humanistic, if you're cognitive, that shows
Mm-hmm.
up. And that's one of the reasons EMDR impressed me as a modality, because I also learned it very young in my career,
Mm-hmm.
as you did. And it's like it's all here.
Yeah.
And I think I was initially off put by some of the, oh, fidelity and this and that. And now as I look back, I could see the position she was in, having to do that to get this
Yes.
verified,
Yes.
because she was fighting an uphill battle.
Absolutely.
Yet I think the more I practiced and saw the art form of EMDR, and then did learn some of these other things, I saw just how much artistry and mindfulness and embodiment is really in EMDR, even in the purest of technical approaches to it.
Absolutely. I
So,
agree,
Debbie,
Jamie.
I just thank you for sharing your passion and your
Mm.
knowledge with us in this interview, which I hope others will continue to access and learn from. And I mean, I feel this way about you. Thank you for your very human approach to this material. Uh, that's why I'm just glad in these last couple of years we've been able to connect and become friendly. And I could just tell that you see above anything else, this is about healing and humanity. And
Yes.
I
Yes.
thank
Yes.
you for that, especially when you're working with complex trauma and dissociation. That we've talked about this so much, that
Yeah.
we, as people who struggle with these things, we could see the genuineness in people more than anything. And yeah, it's great if you have this wonderful approach you can work on us with to help with suffering. But
Yeah.
at the end of the day, it's still person to person
Yeah.
contact.
Absolutely. Absolutely.
And I think Michael shows that to us too
Yes.
in the book. And one more time, just one more plug before we end the interview formally. Every Memory Deserves Respect from Workman Publishing. It's now out wherever books are sold. And again, if you are an EMDR therapist, please add this to your reading list, especially if clients ask you if there's a resource that they can check out on EMDR. And if you are a member of if you're one of my friends who's watching this and I was like, Jamie, what is that thing you do? Read this before you even read one of my books, because
Right. Exactly.
it'll help you get a little bit
Exactly.
more of that every person's understanding. So thank you again, Debbie, so
Yeah, Jamie,
much.
thank you so much for the opportunity. It's like really, really wonderful to sit with you and chat and reflect. And I just appreciate the invitation tremendously.
My pleasure. Till we meet again, Debbie.